Hey YouTube friends, do you suffer from forehead pain, back of the head pain, temple pain, achiness around the head, pain behind the eyeball, discomfort just deep in the head? You might be having a tension headache or a migraine. They're a little bit different, but they have similar root problems. And in this video today, I'm going to tell you about 3 exercises that you can start to do right now that treat the root of the problem so that you can find some relief for your tension headache or migraine problem. I'm Dr. David. I'm a specialist physical therapist over at Paso Manual Physical Therapy, and I've helped out people with tension headaches and migraines for years. It's quite simple to treat, actually. It just depends on which type of headache it is, what type of migraine it is, what the root problem is. Once we have all that ironed out, then treatment is pretty typical. But I wanted to do this video for you where we cover the top 3 most used exercises that we give patients for tension headaches and migraines, so that you might start to try these at home and be able to get some relief. So number 1, towel stretches. I'm actually going to use a pillowcase. I've got one right here. So what you want to do is grab your towel or your pillowcase and fold it the long way, like so it's kind of long, and then twist it a bit just to make it a little more narrow and stiffer. And then what you'll do is put it around your neck like so. The point of this exercise, it's kind of a stretch and an exercise, is to free up stiff joints in the neck to allow the nerves that are potentially aggravated in your headache or migraine problem to move better. That way you can get some stiffness taken care of in your neck and muscles as well. So what you do is you pin one hand down against your chest here, and then the other hand, you're gonna pull it against your neck bones. Even if it's a bit tender in the neck bones, you wanna push into it as long as it's not too uncomfortable to where you're cringing or wanting to cry or have some pretty severe pain. It should just feel like some mild tenderness at most. And you're pulling into those neck bones as you kind of turn in the direction. Now I want to emphasize here, the point is not to stretch your head in rotation as far as it'll go. You don't want to turn as far as you can. You're forcing the motion with the top end of the towel or the pillowcase here and just mildly turning. My neck actually popped just now when I did that. And you're just, as I'm turning lightly, I'm not turning as far as I can. This is as far as I need to turn here. It already unstiffened in my case, but I have the ability to turn my head farther. The point is to put that towel on the part of your neck that's stiffest, and then with your hand pulling in this direction to free up the joint. So you might just do that for 20, 30 seconds, maybe a minute. I'll sustain some pressure and then just give it little baby bounces at the end, and then go the other way and just move like that. I can still turn a lot more, but I'm not trying to stretch my neck. Like I said, I'm just trying to move the joint right where this towel lines up on my left side in this case. The second exercise is chin retractions. This one is a good one to get the deep neck muscles working to help to give stability to your neck for your head and neck. It's real simple, and the way that it's commonly done though is you repeat a motion. I don't want you to repeat a motion, I want you to do holds. So you gotta have your head and neck real nice and tall, do a little baby double chin, and then do a big double chin, just like that. And it's not looking down. Notice I didn't tip my head down. I shoved my head back on my neck, and that turns on those muscles that are behind your throat right here. Hold that. Go about 50 to 75% intensity. If 100 for me is right here, I'm gonna back off to about 50%, and I feel those muscles behind my throat working. Hold it there for 10 to 20 seconds, 30 seconds, and what you should feel is a light, very light stretch on the back of the neck, and then the muscles in the front of the neck working. That's good. You want to do that. Do about 10 of those holds all in a row. Really, you can go as many as you need to begin to get some relief. If it's the right type of tension headache or migraine problem, you should begin to get relief the more that you do that exercise. The exercise should not be aggravating. It should not bother the headache or the migraine problem anymore. It should give it some relief, if anything. If you find that this exercise is making it worse, then don't do this exercise. There's a few cases of migraine and headache problems where this is not the best exercise to do. So just pay attention to your symptoms. You should know right away as you start to do it if it's getting worse or better. The third exercise is going after upper body weakness that commonly feeds into headache and migraine problems. You want to do a shrug exercise. So practicing a little bit of that same chin tuck maneuver, that double chin maneuver, just lightly tuck your chin down like that or backwards. Then you want to shrug. Just bring your shoulders up to your ears as high as you can go. So I'm getting a little shaky here while still holding my neck in place. Hold that for 10 seconds. You should feel these muscles over here getting tired. That's good. And then repeat that 10 times. So do 10-second holds 10 times. Tuck the chin in, retract your head back, and then do a big giant shrug as hard as you can, as long as it's not hurting. And here I'm squinting, not because it's hurting, but because I'm giving it a lot of effort to shrug my shoulders up, and I can feel these muscles on both sides squeezing and tightening, and that's exactly what you want. After doing 10-second holds 10 times, or do less if you need to, if it's just starting to bother you or it's a little uncomfortable or hard to do, just do 5 reps of that, or just hold it for 5 or 6 seconds or 7. But generally 10-second holds 10 times should give you some relief after you do that. You'll feel tired, like you worked out a little bit, but then in the moments after that resolves, the tiredness goes away, it should feel looser and some relief through your headache, migraine problem. Thanks for watching, YouTube friends. If you found that this was helpful for you and you tried out these exercises and have gotten a little bit of relief, excellent. Keep going with those exercises. It should get even better as you get a little stronger in those muscles and move your joints using that towel or that pillowcase. It should continue to improve the more that you do if you found that it's already helping you out. So if you found that it was helpful, please give us a like right here. Share this video over with a friend or a family member that you think needs to hear this as well and try these exercises out. And if you want to get notified whenever we release new content helpful for your health, hit the subscribe button over here so you can get those notifications. And if you're looking for more help right now on neck issues, exercises for neck problems, sometimes these headaches can turn into shoulder issues as well because the way the nerves are connected. Oftentimes people with neck and headache problems, migraine problems, also have shoulder achiness, knots up in this area. If you're looking for more help with that, hit the logo here on YouTube so you can get taken over to the home page for our YouTube channel and scroll down a bit and find the playlist that's titled Neck and Shoulder Videos. You'll find tons of more helpful videos in there so that you can get more tips. I hope you have a wonderful day. Bye-bye.